We're going to start public comment, and just as I said at the start, we're going to do 2 minutes at a time just to attempt to get through. We're going to start here on our left, and then we'll alternate here to our right.
Great. Thank you very much. This was a terrific hearing. I'm Allison Bust with the Children's Defense Fund of California, and I'd like to speak today on behalf of CDF California and the Children's Partnership. California is stronger when everyone has access to health coverage and care, and California took a huge step forward a few years ago by passing Health for All Kids that extended Medi-Cal to undocumented children. However, research clearly shows that when parents and caregivers are covered, children are more likely to have coverage and get timely care. And also, parents who are healthy can better care for their children. So extending coverage to all Californians will help California's children, 1 in 6 of whom have at least one parent who is undocumented. CDF California and the Children's Partnership strongly support the Health for All proposal presented by the CIPC panelists and in the Assembly budget blueprint. Speaking now only for the Children's Defense Fund, I'd like to make the point that income eligibility levels, affordability protections, and comprehensiveness of benefits for children are very different than those of adults in Medicaid and CHIP. In particular, Medicaid's comprehensive, pediatric, and developmentally appropriate EPSDT benefit is the gold standard, unparalleled in any insurance product. And this is what all children need to develop into their full potential and to become tax-paying citizens. We feel very strongly that any proposal moving forward must think upfront, not as an afterthought, about how the proposal will impact children, particularly the most vulnerable. Any attempt to make incremental or systemic changes to the current system must not result in children losing ground from where they are today. Reform proposals must ensure that coverage for children is affordable, easy to get and keep, and not subject to the lottery of geography, and that care is comprehensive and pediatric appropriate. Finally, as you work toward universal coverage, we ask that you recognize the special protections that children now have and to build on that progress, but at a minimum to do no harm. Thank you.
Thank you, ma'am.
I'm Melinda Markowitz, registered nurse and president of the California Nurses Association. Recently, the Republicans and President Trump rammed through a bill that gives a huge cash tax cuts to the rich. Elimination of the mandate to buy insurance was one of the most destructive components in the tax plan, which analysis suggests would prompt insurance to levy new double-digit premium hikes. If we don't implement single payer, the result will be millions will lose or not be able to afford their health insurance, and even more premiums rising. Fortunately, there is an alternative in California, a state bill that would guarantee health care coverage for all. Senate Bill 562 is not a symbolic bill. SB 562 is a comprehensive reform, as you heard today from Michael Lighty, and has health care funding finances, as Dr. Pollin said. As a registered nurse, I have watched our patients suffer. We have heard stories from our patients delaying care, cutting pills in half, or taking medication every other day due to the costs. Having to make a choice to get medical care or have to buy food, having to declare bankruptcy, or because of mounting medical bills. We are seeing all too frequently the diabetic patient in for limb amputation, a preventable outcome if they have access to health care. But because they have to choose between rent and food or insulin, the foot loses. Single payer is a plan that the California Nurses Association has been fighting hard for to end stories like this. And I will say we don't believe that any transparency bill, any principles will really stop those stories. California is really looking forward to working with the Assembly to address these issues and concerns that may be raised during the legislative process. But the people of California deserve an Assembly that will do its job, that it holds public hearings as part of the democratic legislative process, and consider any amendments and votes on the bill that is critical to the people of the state. So my ending words are, We, the nurses, demand that Speaker Randon release the bill out of the committee and do his job. And we hope that this committee and all Assembly members will help us with that, because enough people have died and will be losing their lives. Thank you.
Good afternoon.
Thank you, ma'am.
My name is Kathy Donahue. I've been a registered nurse for almost 25 years in a maternal child unit, which I should not see death, but I do, of both maternal and infants, sadly to say. As a registered nurse, my license requires that I be a patient advocate, something I take seriously. Everyone here has either been a patient or will be a patient, so my advocacy includes all of you. As elected officials, it is your obligation to do what is in the best interest of those who elected you. If everyone in each of your districts had the care they needed when they needed it, we wouldn't be here today. Sadly, this is not the case, and we will continue to see unnecessary deaths until SB 562 is legislated. I'd like to address the elephant in the room. Why hasn't the California Nurses Association, the nurses of this state, and the proud sponsor of SB 562, not to mention the recognized catalyst of these hearings and responsible for raising public awareness on this important public health issue, been given so little time to discuss guaranteed health care for all SB 562. There have been 6 hearings by the Select Subcommittee, including today's, for approximate 32 hours, 19-20 minutes. For some reason, you've decided to give the nurses only 30 minutes of that total time to talk about the only solution that would guarantee health care for all. In other words, this committee has allotted 1.5% of its time to hearing from the nurses about the only meaningful solution to our health care crisis. And that is the only solution that would guarantee health care for all. That means this. Can you explain this? Upon what basis did this committee determine to allot only 1.5% of the time to the nurses and their representation of what they think the solution is? SB 562. This must stop. Get insurance out of our health care. SB 562 is needed now. No more delays. No more dog and pony shows. Enough is enough.
Thank you, ma'am.
Good afternoon. Linda Way with Western Center on Law and Poverty. Firstly, would like to thank the Assembly for holding this very important hearing and align our comments with some of the previous speakers, particularly Health Access, California Immigrant Policy Center, as well as Labor. Particularly, we are in strong support of Health for All. We believe that we've, through Health for All Kids, we've gone, we've made vast improvements, but in terms of getting to universal coverage, recognizing that over half of the uninsured are undocumented people, we strongly support Health for All, as well as when we talk about universal coverage, talking about another population that was left out of the Affordable Care Act, seniors, individuals 65 and older, who just because of their age are subject to a lower income eligibility threshold in Medi-Cal. So urge consideration of raising that threshold so that there is a bright line for all adults, seniors, whether you're born in this country or not. In addition, looking at some of the gains that were made through the ACA and how many people are covered through Medi-Cal, really holding plans accountable by looking at quality and year-over-year improvements. And so these are just a few of the things that we believe can happen in the short term, and so are in full support of those proposals. Thank you.
Thank you, ma'am. 2 quick notes, just again, after 2 minutes, we're going to turn the mics down only to make sure we have time. The second one is that I've been notified by the sergeants that we're at capacity currently within the room. And so those who testify, if you go to the overflow rooms, it may allow the others to enter the rooms to testify as well, to make sure we give as many voices as possible. So with that, please, sir.
I thank the committee for giving me this opportunity to speak as a member of the public. My name is Dr. Jonathan Pierce. I'm a 68-year-old internist and completed my residency at UC Davis and retired at 66 from primary care in semi-rural Grass Valley, Nevada City area. I plan to work until at least 69, if not 70. as many of my colleagues have discussed, but could not maintain practice mainly due to onerous administrative work pressures having to do with private insurances. I had 1.5 full-time employees or providers, myself and a part-time nurse practitioner. My patients had almost exclusively Medicare insurance, some with Medi-Cal secondary insurance. And I'm talking with you about this so you can get an anecdote from a practitioner. And that's why. With the single-payer systems avoiding a claim approval process, I would have saved about 1.6 full-time employees for administrative costs at about $50,000 per year in my practice, conservatively said. So, thanks. So, if Healthy California were implemented, I estimate I would have been able to see 3 to 4 more patients a day and probably keep about 350 more patients in my total patient panel. So I've talked with other primary care practitioners in my area, and I estimate about 5,000 to 8,000 former Medi-Cal patients would be able to get a primary care doctor who cannot now if this health care for all system were implemented. As my time is running out, I have a few other points, but I'm going to stop, and I just ask this committee, with all the hard work you've done, please ask Speaker Rendon to release SB 562 from the Rules Committee for floor debate. Thank you very much.
Thank you, sir.
Hello, my name is Dr. Natasha Lee. I'm president of the 27,000 member strong California Dental Association. I live and practice dentistry in San Francisco and also serve as a dental school assistant professor. I want to thank the committee members and witnesses for their thoughtful testimony, insightful questions, and difficult work over the last several months. It is essential that oral health and dental coverage continue to be part of the health care reform discussion. Dentists and their teams are acutely aware of how poor oral health contributes to poor overall health and is associated with systemic disease. Gum disease has been associated with adverse pregnancy outcomes, respiratory disease, cardiovascular disease, and diabetes. Poor oral health contributes to chronic pain, lost school days, unemployment, low self-esteem, and higher healthcare costs, including overuse of our hospital emergency rooms. This is why CDA has joined with other provider groups to oppose SB 562. Our goal is to protect the gains we've made in expanding healthcare coverage over the last several years. We are committed to continuing our work to expand access for Californians who do not have regular access to health or dental care. We know the existing system is not perfect, which is why we have come before you in recent years to urge investments and improvements. Addressing the gaps that exist in the current system is the more prudent thing to do rather than recklessly throwing out our entire system and losing focus on the progress we are making to instead pursue an undefined and unfunded single-payer system. As you weigh the proposals presented today, I urge you to protect the progress California has made under the ACA, especially the positive steps the state has taken to increase access to dental coverage through Medi-Cal and Covered California, and to look for pragmatic opportunities and alternatives to address the remaining gaps. CDA is committed to working with you as you search for real solutions to fortify California's healthcare system and to ensure that oral health has a seat at the table. Thank you again for your time.
Thank you, ma'am.
My name is Juliana Milanese. I am representing Jobs with Justice, a broad coalition of 40 community and labor organizations in the Bay Area, San Francisco and Sonoma. Our coalition includes diverse organizations that support and empower workers in low-wage service jobs, immigrant community, and communities of color, all severely impacted by the healthcare crisis. We fully support SB 562 as the best solution to provide universal health care to universal access to high-quality health care for all. On a personal note, I lost my father, who was 53. I lost my husband, both who were denied critical treatments at Kaiser, which could have saved them. A doctor following my husband's death, crying, said to me how he was sorry and how many times this happens. The cost was a huge factor in my loss. We urge the Select Committee and Speaker Rodin to move SB 562 forward as the only solution to guarantee quality health care for all.
Thank you, ma'am.
Good afternoon. My name is Angela Perry with Consumers Union, the policy arm of Consumer Reports. As an organization steeped in advocacy for access to affordable, safe, high-quality health care for all consumers, we're deeply appreciative of these committee hearings. Over the past 7 years, California has done a remarkable job to expand health care to millions of Californians. But we are not done. As you've heard from several speakers today, coverage gaps still remain, and coverage, unfortunately, does not guarantee access or affordability for everyone who lives in California. We hope that the efforts to combat the steep rise in cost and care and to improve the outcomes of care are interwoven with efforts to solve the problems and gaps of coverage. We thank the committee for these hearings and look forward to thoughtful and productive conversations in the coming year.
Thank you, ma'am.
Good afternoon. My name is Gustavo Herrera, and I'm the Western Regional Director of Young Invincibles. Young Invincibles is a national research, policy, and advocacy organization dedicated to amplifying the voices of young adults across the issues of healthcare, workforce, higher education, and civic engagement. Our mission is really to continue to build the economic security and political participation of young people across the country. You know, throughout our work across California, we have connected with many young adults living in mixed immigration status families. We hear stories from those young adults of low-income, undocumented Californian parents that are locked out of access to health care and are suffering and dying from treatable conditions. And it doesn't stop there. When young Americans have to care for ill parents who are unable to access affordable health care, it creates a domino effect. Young adults in this position are forced to make tough choices about continuing education, career choices, and even starting families. We know that the social and fiscal costs of excluding a segment of the state's population sets back California as a whole, and we believe that we all have a stake in promoting the well-being of all Californians. We are proud to be here with you as a member of the Health for All Coalition, also as a CAPA advisory board member in support of addressing the overall cost and quality of care and moving us towards a healthcare system that expands coverage for all Californians. Thank you.
Thank you, sir.
Thank you. Stuart Thomas on behalf of the California Medical Association. I just want to first thank the committee for all the work that you have put in. There's been a lot of hearings, and it's been extremely informative. So first of all, thank you. I think for a lot of the advocates, a fundamental question a lot of people are still struggling with is how much additional funding is going to be available for proposals this year. I think any of the proposals you'd hear, both short-term and long-term, will require an increase in funding in this year. And so if we get a better idea of what that might be, I think that will help inform the decisions this committee makes. The California Medical Association is going to focus on proposals that do not require federal approval going forward. Just given the climate in D.C., we think that is the best way to progress. And we're going to be guided by four kind of fundamental underlying principles when we look at legislation. The first is universal access, making sure every Californian, regardless of immigration status, has access to care and coverage. The second is affordability, especially with low-income and middle-income people who don't qualify for Medi-Cal. We can do this in the form of more general subsidies, but that population really is the one kind of getting crushed a little bit in that market. Third, physician workforce development. I know we've worked with Dr. Rambula on some GME funding, and we look to continue that advocacy this year. And finally, market stabilization. And this can come in the form of reinsurance programs, and there's some other policy proposals, but making sure that the premiums do not go up double-digit every year, and giving some certainty to that market to ensure low prices. So with that, thank you again for all these hearings.
Thank you, sir.
Hello, my name is Diane McClure. I'm a registered nurse and have been for 29 years, and I work here in a recovery room in Sacramento area. The lack of political will is the real problem here. All the counterattacking engaged in by the co-chairs of this committee, as well as the speaker, have been about SB 562 supposedly lacking in details, but without adequate discussion with the nurses, the main sponsors of SB 562. Stop attacking the nurses. Stop trying to negotiate the bill in the press and stop the facade. We need to move past these hearings and start seriously talking about the nurses' solution, single-payer, guaranteed health care for all, and stop bending over backwards to go to the opposite direction by calling for more insurance for people and thereby take the side of the insurance companies, please. Our patients demand it, the nurses demand it. The Assembly needs to develop the courage to recognize that SB 562 is not woefully incomplete, as you heard today. This is a diversionary tactic designed to keep the focus off the fact that there is a severe lack of political will in the Assembly to help patients, but an abundance of political will to help the insurance companies. We need guaranteed health care for all. We need SB 562.
Thank you, ma'am.
Yeah, good afternoon. My name is Floyd Bryan. I'm from the International Longshore and Warehouse Union, Southern California District Council. And we are very much in favor of 562. We want it. And we also, we've always worked for social justice in the Longshore Union, and healthcare is a right. We don't understand. People in this room, very few of you have better healthcare than I do. But my biggest question to you up there is why not? Everybody in this room should have health care on a parity with what I have. We have other locals that don't have health care. You know, they have to pay they make $13 an hour, and then they pay $300 in a copay, $300 a month. So they're down to $11 an hour to live on, them and their family. Why can't we do better? Why can't we take the money that my local is spending on health care, because it is part of the negotiations, and put it back into wages and pension and back into the economy? And you sit up there and say, well, you know, we're not sure how we do the money. This is the 6th or 8th, I'm not sure which one, largest economy in the world. And you guys can't figure that out? I mean, seriously, I've been working on this for the last 20 years. And my last question is, how much longer are we going to kick this can down the road? Seriously.
Thank you, sir.
Good afternoon, Drs. Wood and Arambula and esteemed members of the Assembly. My name is Sandy Redding. I'm on the Board of Directors for the California Nurses Association and an operating room nurse of 30 years. I've heard a lot of talk about incrementalism and also universal coverage by way of health insurance, and that's not the answer. Insurance is not health care. We know that. And I'll tell you a little story, and I know you've heard a lot today. I worked side by side with a nurse. That nurse worked very hard, got a cancer diagnosis, and exceeded the treatment time, so the hospital fired her. There was a break in treatment, and that nurse passed away. That's not acceptable to me. That's personal to me. And I will fight for SB 562 and health care for all until I take my last breath. I'll tell you another story. I was wheeling a child into the operating room when the billing person came with a piece of paper and said, wait, wait. And I said, wait about what? First of all, don't get between a nurse and her patient, just tell you that. That child did have surgery, and I had to go up the chain of command. We don't do surgery on people that don't require it medically, okay? So incrementalism is not the answer. Insurance is not access to health care. We need SB 562, and our patients cannot wait.
Thank you.
My name is Jennifer Holm. I've been a registered nurse for 12 years, and I work in a neonatal intensive care unit, so I work with tiny babies. Speaker Rendon has claimed publicly that he has spoken at length to the sponsors about making the necessary amendments to SB 562. The truth is, after freezing the bill in the Rules Committee on June 23, 2017, the Speaker has never spoken to CNA legislative advocates or policy staff or any nurse leaders of CNA at any time about the bill, despite multiple requests from us, the lead sponsors of SB 562. CNA has said over and over again that we look forward to working with the Assembly to address any issues and concerns raised during the Assembly legislative process. The people of California deserve an Assembly that is released to do its job. free to consider amendments and vote on a bill that is critical to the people of this state. Instead, the Speaker has chosen to ignore this responsibility and attack the very people trying to improve the health care of this state. When he says that we haven't had an opportunity to have an honest discussion about single payer, could that not have happened during the processing of SB 562 through the normal legislative process, which also includes hearings such as this? Why hasn't the Speaker let the bill proceed through the normal legislative process in which politicians would be held accountable for their actions on this very important matter? Please release the bill. Get the insurance companies out of our health care. We need guaranteed health care for all, not guaranteed insurance. We need SB 562 now.
Good afternoon. My name is Jane Sandoval, and I'm a registered nurse. I've been a registered nurse for 33 years. I work in an emergency department in San Francisco. So I see on a daily basis patients coming to the emergency department for care due to lack of or poor or complicated access to care. For businesses buying policies apart from the Affordable Care Act, which is where most Americans get their coverage, the next year's premium increases are expected to rise by unprecedented percentages at large companies. Premiums for employer plans rose 3% this year to an average of $18,764. That cost is usually divided between employers and workers. The costs keep going up. People can't afford to use their insurance. Many effectively have no health care. This must change. Get the insurance companies out of our health care. Health care is a fundamental human right. We need guaranteed health care for all, not guaranteed insurance. We need SB 562. Let us eliminate health care inequality and level the playing field now.
Thank you, ma'am.
Hi, my name's Martha Cool. I'm a registered nurse, and I'm an officer with California Nurses Association. I want to tell you about 2 children with cancer that I see on my job. They're ideal children, and they have the same diagnosis. Child A comes from a wealthy family, has good insurance, has good primary care. Child B comes from a poor family, has no primary care, or no insurance, or is underinsured. Child A gets an early diagnosis and prompt treatment. Child B has delayed diagnosis and delayed treatments and missed appointments. Child A and Child B, both, because of their diagnosis, need specialty care to survive. Child A gets it, Child B does not. Child A survives, Child B does not. This is the grim reality of our healthcare system. The committee members here enjoy the benefits of a taxpayer-paid, guaranteed health care. Yet some still do not want to guarantee taxpayer-paid health care as a social and economic right to the rest of us. It appears to me that this is due to a lack of political will. If this is not true, from what you say, if this is not true, please stand with nurses to protect and advocate for our patients. We call on you to get Rendon to release the bill. It is the only concrete proposal before you. Release SB 562, move it through the regular legislative process. We all know that health care justice cannot wait.
Thank you, ma'am.
Hello, my name is Carol Coley. I've been a nurse for 24 years on a cardiac unit. Healthcare is a basic human right. All of you seem to agree. But if something in fact is a human right, it cannot be denied just because someone can't afford it. But that's the system you, the Assembly, are promoting and backing, one in which healthcare is in fact denied when someone can't afford it. So you can't have it both ways. You can't claim that health care is a human right while simultaneously endorsing a system that denies health care when someone can't afford to pay. The two are mutually exclusive. Stop misleading the public and choose one side or the other. Like the Bible says, no one can serve 2 masters. Either you hate one and love the other, or you'll be devoted to one and despise the other. You cannot serve both gods and money. The same is true in this instance. You cannot serve the people while serving the insurance companies. You hate the one and love the other. In our current system, and the one clearly being promoted throughout this select committee hearings, insurance companies and their profits are loved by our politicians first, while the people, the patients, get lip service about health care being a human right. There is only one way to ensure that the health care is truly a human right, and that this is being supported is the only bill that calls for the true single payer, guaranteed health care for all. We need health care for all. We need SB 562 now.
Thank you, ma'am.
Mark Van Landuit, Our Revolution Contra Costa. Distinguished ladies and gentlemen, this is a heavy lift. It's a heavy lift, and it will require our moral strength. When I was driving over, on one of the overpasses was the sign, "What would MLK do?" We just recently celebrated the memory of Dr. Martin Luther King, and it's appropriate that we're talking about this now because the fight for healthcare equality is the fight for social equality. It is the fight for economic equality. It is the fight for racial equality. And years from now, it will be asked of us, what were we doing when millions of Californian families were suffering without health care? And I think it's important in this debate to prioritize the voices of the nurses. They are on the front lines of this broken system. They know the faces behind the numbers. They know the stories behind the statistics. And to underline the urgency of this moment, it can't be done enough. Every day we let this crisis continue, it's another neighbor gone. It's another family member gone. It's another child gone. So there is no better way to honor the legacy of Dr. Martin Luther King than to forward, to advocate, to fight, to pass SB 562. Please be leaders in that fight. Thank you.
Thank you, sir.
Good afternoon. My name is Dolores Trujillo. I've been a registered nurse for 18 years, and I work in a neonatal intensive care unit. One hears the criticism that SB 562 cannot proceed because all of the details have not been spelled out ahead of time. This is wrong. But for the absence of political will and leadership in the Assembly, the details and any alleged deficiencies would have been worked out by now. Single payer, guaranteed health care for all is an idea whose time has come. It requires our best thinking. Now is not the time to stop before we start. Ideas matter, and this idea is supported by the vast majority of Democrats and an overwhelming majority of California residents. Ideas matter, and the embrace of important ideas by those in positions of leadership is how great things are accomplished. Gone are the days of politicians who claim to support guaranteed health care for all or that health care is a human right, but who simultaneously attack the only bill before the legislature that would guarantee health care for all and, in fact, make it a human right. Get the insurance companies out of our health care. We need guaranteed health care for all, not guaranteed insurance. Release the bill. We need SB 562 now.
Thank you, ma'am.
My name is Casey Carpenter. I'm a parent. I'm an elected delegate in the California Democratic Party. I'm a leader in Our Revolution. I also lead the California Democratic Club, Bayshore Progressive Democrats. Healthcare is very personal to my family. My daughter's a cancer survivor. She survived. She's now in her second year of med school. My son has asthma. Without insurance, I would not be able to provide him the medical drugs and prescriptions he needs. And 93-year-old Grandma Mary, let me just say, she is caught in the cracks of our broken healthcare system in California. Now, 10 years ago, my parents actually retired and moved to Mexico. My greatest fear was, what about healthcare? Now family members are flying down to Mexico to get dental work in Mexico. It's actually great work at half the price they can get from the other dentist that spoke earlier. And did you know that you can book a first-class ticket, including a weekend in Acapulco, and get health care in Mexico? We're not talking about Canada. So California may be leading in many areas. I heard someone say we're leading. This group is not leading in health care, not in any way whatsoever. I heard someone say a field trip to Maryland. How about a field trip to visit some of the nurses and experience health care and the gaps that are happening in our system today? It's broken. Your job as elected officials is to lead. Bring together those constituents and let's really get this done in California. No more, we're afraid what the Trump federal government's going to do. We're California. Let's get this done. Release this bill now. Do your job.
Kimberly Chen on behalf of the California Pan-Ethnic Health Network. Thank you for the conversations here today. I want to focus my comments on 2 points. First, we're pleased to hear the growing support for ensuring access to health care to all Californians regardless of immigration status. We strongly support health for all and urge the legislature to act on that this year. Second, there are steps that we can take now to address the disparate level of care and equitable outcomes in health that we're experiencing within the system, particularly in Medi-Cal. We believe we can hold Medi-Cal managed care accountable for these very outcomes and quality of care that they're providing to individuals, and provide the Department of Health Care Services the tools they need to do that. And we believe that we can be doing this to target the disparities that we see across region, across race, ethnicity, gender, sexual orientation, all these factors that we know that impact people's health outcomes. And we are working with our partners at the Western Center on Law and Poverty, and we hope that we can work with members of the legislature this year to move this step this year, and look forward to that conversation. Thank you.
Thank you, ma'am.
My name is Norma Wilcox. I am a registered nurse of over 50 years. I'm currently the president of the Butte County Healthcare Coalition, which is a local organization whose mission is to support a single-payer healthcare system. I'm also a member and director of the organization Healthcare for All, which is a statewide organization, and I'm also an elected delegate to the Democratic Party. And one of the things that I was just thinking about is when we were talking about all the European countries that have universal health care and of varying systems, one thing they have in common is it's all non-profit. It's non-profit. And one of the ways that they get that is through their legislators. It's the legislators' responsibility to create a system so that every person has access to the same high-quality, affordable health care. And I'm going to just share a personal story of how you, as legislators, are responsible for the poverty level. And it's in this way. I was in a car accident, and soon after, my husband was diagnosed with cancer. So we were both unable to work at the same time. It took us 10 years to pay our medical bills. We ended up almost in bankruptcy and homelessness. That never happens in any other country, not in any of the European countries. And it is because of the legislators. They have a responsibility, and they have taken a responsibility to their citizens. Thank you.
Thank you, ma'am.
Good afternoon. Gabrielle Lassard from the Los Angeles headquarters of the National Immigration Law Center. I am speaking in support of the proposal advanced by Ms. Estudillo of California Immigrant Policy Center and included in the Assembly Budget Blueprint, which is to extend eligibility for Medi-Cal to all income-eligible Californians regardless of their immigration status. Undocumented immigrants are among our most vulnerable residents, and excluding them from affordable health care options compounds their vulnerability, harming their entire family and everyone who depends on their labor and economic contributions. And as was noted earlier, denying access to a segment of the community also contributes to the instability of the healthcare system, which affects us all. Covering undocumented residents is a concrete, practical, and humane step towards access to affordable health care for all, and I encourage the legislature to move in that direction. Thank you for the opportunity to address you.
Thank you, ma'am.
My name is Tristan Kasinger. I am a delegate to the California Democratic Party. In addition, I am disabled. My wife is a public school teacher. We have one of the best health care plans out there, and we have drained our savings on my disability. My mother is disabled and has a heart defect that will kill her if she does not get monthly injections. She can't afford those injections. They're $1,200 a month. Her doctor pays out of pocket so that she can survive. My roommate has a tumor on his back that he hasn't removed in years because he can't afford the surgery. He has access to health care. I have access to health care, and my mother has access to health care. Access is a meaningless word, and you should stop using it. Release the bill now. And I want to say one last thing. I would like to thank everyone here for allowing us this opportunity to talk, and I would specifically like to thank Chairman Wood for motivating so many of us who you see here today by his callous and disgusting attacks against the CNA on Twitter. Thank you very much. Except you.
Hello, Andrew Medina of Asian Americans Advancing Justice California. It's a project of Advancing Justice Asian Law Caucus in San Francisco and Advancing Justice Los Angeles. And we're here in strong support of effective universal coverage, just particular for the Health for All proposal that was outlined today by Health Access and the California Immigrant Policy Center. As noted by the CAPC, 58% of the uninsured are unable to get coverage because of their immigration status. Looking at the Asian American, Native Hawaiian, Pacific Islander community in California, over 460,000 of our community members are undocumented in the state. That makes up about 1 out of 8 of every Asian immigrant in California, and nearly 1 out of 5 of every undocumented immigrant in California. When you look at disaggregated data, we find that the Korean, Tongan, Thai, and Cambodian community, as many other communities in this very diverse community, have some of the highest national uninsured rates in the nation. So our affiliates house Aspire and Uplift, which are community-based organizations that are made up of young adults and youth who are undocumented. And working with these communities, we found that a lot of our community members are really concerned about how their parents or adult family members are unable to access health care because of their immigration status. So we know on the ground that this is a very important issue for our communities, and we call on the Assembly, the state legislature, to support Health for All as it's moving through the process of both the legislative and budget sessions. In addition to that, we're also very concerned, and we're moving through this discussion to look at expanding disaggregated data for our communities, looking at closing disparities for a lot of our communities, as well as ensuring that we're building in culturally and linguistically components to all the proposals that are moving forward. Thank you very much.
Thank you, sir.
Hi, my name is Rick St. John. I'm here as an individual. Hopefully I do represent some people. But earlier today, one of the members up there said that, I'm speaking for the Democrats anyhow, we all believe health care is a human right. I would like to ask those up there who do believe that to raise their hand so we all know where you stand. No, raise it high. We need to see you. Okay, so 3. And we also heard that, you know, every day in this state, every day, 8 people die. So it would only take us a day and a quarter to get rid of all of you. How can you be so misunderstanding and heartless? Single-payer health care is the only way. You can tinker with incremental steps if you want, but I'm a retired social worker. In 1982, I worked in prisons in Florida. AIDS came in. It exploded. If we had health care, you would have alleviated a lot of bankruptcies, a lot of people living on the streets, and a lot of premature deaths, and a public health crisis. SB 562, if you don't have to be rocket scientists. You know what Kennedy did when he said we're going to get to the moon in 7 or 9 years? And they said, you're a fool. He went to the experts, appointed people he knew who had the interest and the guts to plan the program. Set up SB 562, so you appoint a board. You know, that right away, that's about paying. Get the criminal mafia of the insurance companies out of it. Who else can go up to you and say, give me $1, and for every dollar, I might give you back 70 cents? Who can do that? But law has set that up. Before 72, it was not that way. Single-payer health care, embodied in SB 562, is the way. Set the thing up. Let the experts determine how best to do it. Otherwise, people are dying needlessly. How can you live with that?
Good evening, Khadija Alam Javed with Advancement Project California. I think after today's hearing, it's clear. I think it's clear that we're all in the same team. We have differences on how to get there, but I think our goal is the same, universal coverage for all. At this point, Advancement Project California is in support of CIPC's proposal on Health for All to ensure access to coverage to undocumented citizens. Thank you for your time and for all these efforts that you have done over the course of months. We look forward to working with this committee and the Budget Committee to making that a reality. Thank you.
Thank you, ma'am.
Hi, I'm Mark Samosky. I'm here representing the American Federation of Musicians, all the locals in California who are in support of SB 562 and getting it out of the Rules Committee and out into the Assembly for debate. I don't have much I can add to the wonderful nurses here that have made their points so eloquently. I've been here for 4 of these meetings, and this one especially was energizing to me because they were able to Robert Pollin was able to present options that are available to a single-payer system, which seems to be where all logic takes everybody for a universal system that'll work. To move ahead, the fellow down here that was the longshoreman made an interesting point about California being the 6th largest economy in the world. I don't see, given how things work in other first world countries where they can spend half the money and get better results, why we can't do that here. And given California's economy, this is California's Saskatchewan moment and your Tommy Douglas moments to become the greatest American citizen, because the CBC did a poll on who was the greatest Canadian, and the winner was Tommy Douglas. Thank you.
Thank you, sir.
Nancy Fleming from Nevada City, California. This is my story. Back in 1976, I was a junior in college, and I was struck with a very serious autoimmune chronic condition. And I immediately became uninsurable. And a year later, when I graduated college, I find myself deciding where to pursue my career, not based on what's the best firm for me to be at, or heaven forbid, to even be able to start my own business. I had no choice. My criteria was finding a firm that had group coverage under which I could be covered, my only option. So for 40 years in that situation, I, yes, had coverage, but I fought with insurance companies on a regular basis, denied coverage. I've spent hours, months, years in telephone calls with insurance companies. And what I find the most disgusting about that whole situation is that it's not because of my care. It was about some shareholder making a profit, or some CEO that needed a new yacht, or whatever it was. Fortunately, in the last year, I've been finally able to make a decision to not work anymore because I can get covered under the ACA. But I'll tell you what, it is not perfect. It is far from perfect. I have insurance coverage. It is obscenely expensive. My premium last year went up 28% as of January 1st, and I'm still fighting with insurance companies. So I want to suggest that we get insurance profit out of the system. It's the only way this is going to work. Bring SB 562 to the floor. Thank you.
Thank you, ma'am.
Hello, Mr. Chair and members. My name is Elena Santamaria with Next Gen America. We're a nonprofit organization that focuses on social justice issues and income inequality. Specifically as it relates to healthcare, Next Gen is here today to express support for the Health for All proposal presented by the California Immigrant Policy Center and included in the Assembly Budget Blueprint. We look forward to working with the legislature in improving our healthcare system to provide equitable and affordable healthcare for Californians. Thank you.
Thank you, ma'am.
Hi, I'm Dr. Elizabeth DeMai. I'm representing Single Payer Now. I'm from Berkeley. I'm a clinical psychologist. I graduated from school with $232,000 of school debt, and my current health plan deductible is $6,000. Our healthcare system clearly doesn't work, and in my opinion, a single-payer system is so obviously the only thing that makes sense, getting insurance companies out of our healthcare. So I ask you to be leaders in this most important moment in our history where it's so clearly time for us to take a stand and do the only thing that makes sense. I thank you for your time.
Thank you, ma'am.
Good afternoon. My name is Gina Gates. I, too, am I'm an elected delegate from San Jose, California for AD 27 with one of the most progressive leaders, our Ash Kalra, who we have sent to you to do some fantastic work. I'm here to tell you that there's a lot of audacity that's going on here. And just like I tell my kids, you want something done, look in the mirror. And I'm telling you, you all need to look in the mirror who are not getting this. Why is it that you say there is no money when you guys cannot pass the tax on an oil extraction tax? I mean, even Pollin from Alaska, who I call Catwoman with those boots of hers, is getting money from oil extraction. But you guys can't find the money, and you guys can't pass it because too many of you are bought and bossed. I'm just going to say it. Bought and bossed. You're not looking at the dollars. That's our money. That's your money to do your job. I want to point out, too, the audacity to cut the Senate at their knees to pull this bill and not move it forward and not to pay attention to these nurses and the doctors. You need to look at the entire picture, friends. To live in Santa Clara County, we're losing our doctors because they can't afford to live there. That's what's going on in our state. We can't find people to fill. I mean, there's a lot of my sisters here, and you know what? We're not young chicks. We are not. And who's going to fill their jobs? Who's going to invest in our community so these people can become nurses too when they can't even afford to get an upper degree because they can't afford the debt? Y'all need to look at what it takes to be a nurse, what it takes to be a doctor. They need to be able to get out from under that debt and thrive. I'm asking you, have the audacity to do what's right. Thank you.
Thank you, ma'am.
Hello, my name is Desiree Rojas, and I come from a family of farm workers. I am the daughter of the co-founder of the United Farm Workers Union. I come from a long history of fighting for farm worker rights and for poor people. And I have to say that I'm absolutely disgusted that SB 562 was frozen. Here's the bottom line. You know it as well as I do. You've heard it from the people on the front line, nurses, teachers, people in education who see children going to school hungry. The only meal that they have in school often is their lunch. And I'm going to tell you, I'm absolutely disgusted. It doesn't take a rocket scientist to understand that we can do this. This bill was frozen because it was thrown under the bus because it was political, because we are owned, you are owned, not us people, but are owned by trinational corporations and corporations who are driving our state down the mud, down the tubes. I wrote and had a resolution passed with the Democratic Party for an oil extraction. Sarah Palin could get it done in Alaska. We could sure as hell get it done here in California. See my T-shirt? It's called the Poor People's Campaign. The revivals here and your moral compass right now is being viewed by Californians. And in May, we're going to take a lot of action across this country because people are getting poor and poor and poor. And without health care, that puts our society and communities at risk. And we're talking about people saving children and families. Whenever there's a family member that cannot get health care, it affects the whole family. For this is your moral conscience. This is the time when we act and stop pretending that nothing's wrong. I'm also a Democratic delegate. And when I get to San Diego, you better believe that we are going to be talking about SB 562. Anthony Rendon and Governor Brown, you should be ashamed of yourselves, desgraciados.
Thank you, ma'am.
Hello, my name is Robin Wallace. I live in Nevada City. I'm a retired nurse and very proud of the CNA and all that you've done, all that they've done. That's why I'm here. I'm also a naturalized citizen from Canada. I've lived here for a long time, and I go back and forth to Canada because I have lots of friends and family there. Now, I came 3 weeks ago with Nancy Fleming. You might have seen her before. She had a sling on her arm. And we were here, and on her way home, she fell in her driveway and broke her elbow, left elbow. Since then, 2 weeks later, she had surgery, a plate and 2 screws put in, and probably in another week or so, she'll get it removed and she'll be good. Now, coincidentally, I was back in Canada, in Toronto, last September, with my very good friend, and she fell and broke her elbow. And I spent hours with her in the emergency room, had a cast applied, and then a referral to go to an orthopedic clinic, which we did. Many hours later, she had an appointment for surgery. She had that 2 weeks later, and with a plate and 2 screws, and then she had that removed, and she's fine. She didn't wait. How many months? 8 months for an orthopedic surgery? No, she had it in exactly the same time as my friend Nancy. The other thing I want to say, when going through in Toronto in a big hospital, St. Mike's, and very crowded, very busy. There was no mention, there was not even a whisper of cost. There was no mention of deductibles and copay and premium. This is what Canadians they expect, and that's what they get.
Thank you, ma'am.
Good afternoon. Thanks again for having this hearing. I'm Eric Leanson, co-director of the Business Alliance for a Healthy California. We are businesses that support SB 562. I've actually been a little surprised there hasn't been more business representation to testify what the issues are facing business. You haven't had a particularly sympathetic business crowd in the audience, I've noticed. But I think you have to understand that as businesses, we share many of the same concerns as the grassroots activists, because what we're seeing is that health insurance costs are eating away at our ability to survive, to provide for our employees. People in business are getting angrier and angrier about where things are going because the prices don't seem to stop going up. So you have the high costs, but you also have the issue of lack of recognition of what our new economy is doing. More and more people are being forced into the so-called gig economy. We've heard a little bit about that, but how are these folks, whether they're entrepreneurs or not, going to survive in an economy where they do not have ready access to health insurance? I mean, I think we have to really look at this issue if we want to unleash entrepreneurial skills in the state. And I think one of the innovative things that we can do here in California is untie the question of health insurance, health access from employment. I don't see where at this point in the 21st century it really is very useful as a system. It has not worked for a long time, and I think if we want to grow this economy, we'd be well served to understand business can pay its rightful share of health costs, but let's not continue saddling business with the need to operate this system. Thank you.
Thank you, sir.
Hello, my name is Jacob Miller. I'm with SCIU Local 721. I'm an animal care technician for the City of Los Angeles Department of Animal Services for the last 16 years. When I got my job as a civil servant, one of the main reasons why I went into it was because of the good health benefits that came along with it. However, these all come at a cost, and as the rising healthcare costs go up, we have difficulty bargaining for a higher wage to be able to cover these costs and to be able to take care of everything that goes on with my life. I'm a father of a special needs son. He's autistic spectrum disorder. And we had to have in-home healthcare workers come into the house. And thanks to help from my parents and through the regional centers, we were able to cover the copays. However, my insurance company would have charged me copays for every single visit, which would number about 3 times a week, and would have been very unaffordable, and my son wouldn't be able to be in the position that he is right now, which is unrecognizable from back then. Healthcare workers and child care workers are very near and dear to me. My mother-in-law is a child care worker. She has a difficult time. They have a difficult time, getting their health care done. And at any rate, it costs a lot of money to care for ourselves. And it's hard to make ends meet. When I was in the emergency room a couple weeks ago due to the flu, I had an emergency room visit cost. The pay for that basically meant that, I had to skip a number of lunches and breakfasts just so I could make sure I kept food on the table. Anyways, I hope you guys can do what's necessary in order to stop the runaway costs. Thank you very much for your time.
Thank you, sir.
I'm Henry Abrons. I'm a physician, former board chair of the California Chapter of Physicians for a National Health Program, an organization founded 35 years ago to focus solely on the development of single payer. We do research, we do advocacy, and we do education. It's really gratifying to have heard single payer mentioned so many times during these hearings by the audience, by the witnesses, and by the committee. I have to say, as a student of single payer for many decades, that I feel like there's a lack of understanding of really what single payer is. I think that the committee gets a grade of somewhere between C+ and B-. But don't be discouraged. You're all smart enough to understand it, but you need to keep studying it. We asked to testify, and we were politely rejected. But I think that we'd like to be a resource to the committee so that you truly understand single-payer policy. For example, the talk about cost control. Single-payer is cost control. It's setting prices, and it's setting a budget. And then it's running a healthcare system on behalf of the public as custodians of their money and staying within budget. It's very easy to do conceptually. I'm not saying it's easy to do day in and day out. The last comment is about the 2 tracks that the committee envisions, at least some of the committee members envision working on. One of those tracks continues to be incremental reform, and I'm not opposed to incremental reform. But I think we need to keep our attention on the other track, because the other track leads to the top of the mountain that Anthony Wright talked about. The incremental reform track leads from one obstacle to the next obstacle to the next obstacle. It was characterized decades ago as billions for Band-Aids, and that's what it is. It's very honorable to take out a Band-Aid and put it on a wound, but it's not going to solve the problem. We need a transformation of our healthcare system. So I hope that you will take advantage of an opportunity to learn more about single payer.
Thank you, sir.
My name is Ryan Skolnick. I'm also an elected delegate to the California Democratic Party, and there are a few truths that need to be brought forward right now. First, the premise of this committee, to be frank, is a sham. We had an awesome conversation with Robert Pollin, who wrote the study, which until recently a lot of you refused to acknowledge even existed. Why on earth was that conversation not held with the stakeholders and the members of the Assembly Appropriations Committee, where funding could have actually been added to the bill and we could have solved a lot of the problems that Rendon uses as a justification to shelve the bill? Michael Lighty talked about a lot of the policy issues with the bill, addressed a lot of your questions. Why on earth was that conversation not held in Chair Wood's Health Committee? That's your job as legislators. Not a single person here, I know that this is the narrative some of you like to push. Not a single person here believes that SB 562 can be signed into law the way it is now. It needs to go through the legislative process, and at the end of the day, as legislators, that's your job, to legislate. We heard earlier today that there are 8 people in this state that die every day from lack of health care. They don't need to die. The rest don't need to suffer. Everyone here knows of at least someone who is at least suffering because they don't get adequate health care. It doesn't need to be that way. And those people need fighters. They don't need excuses. Instead of shelving the bill and saying, well, what about waivers? We want you to work to create that parallel funding structure that Michael Lighty talked about earlier. Instead of talking about how funding mechanisms may not be good or not, we want you to go to appropriations and put everything on the table so we can come to a bill that truly guarantees health care, not coverage, care to everyone as a right. So I'm asking you all, please, do the right thing. Pressure Rendon, release SB 562.
Anthony Galassi with the Greenlining Institute, and I'd like to make 2 brief comments. First, we proudly support the Health for All proposal included in the Assembly Budget Blueprint presented by Ms. Estudillo and the California Immigrant Policy Center. We believe this is a vital opportunity to create a healthcare system that abolishes medical redlining and welcomes all Californians regardless of race, immigration status, and income. But secondly, and this hasn't been brought up a lot today, universal coverage will also create thousands of high-quality healthcare jobs that we need to make sure goes towards the communities that we're actually talking about when we discuss the remaining uninsured. By engaging in the discussion with hospitals and clinics, with doctors and nurses and allied health professionals, with educators and advocates across the state, we can make sure that the populations we're seeking to uplift and cover with healthcare are the ones who are caring for our communities as well. Any serious proposal to achieve universal coverage has to include pathways of opportunity into the health sector, especially for young people of color. And by doing this, we can make sure that universal coverage actually leads to better care. Thank you.
Thank you, sir.
Good afternoon. My name is Christine Fitzgerald. I'm the community advocate for the Silicon Valley Independent Living Center. We are one of 28 independent living centers throughout California, from Humboldt down to San Diego. All of us here have 3 things in common right off the bat. We need universal health care. Disabilities do happen to anyone across the board. Doesn't matter gender, race, creed, orientation, doesn't matter. And there's red blood running through all of our veins, so we have much in common. I have much in common with the young girl that was spoken about a little bit earlier, Isabella. I have cerebral palsy like she does. She is going through some serious challenges trying to get medical coverage. I, on the other hand, have medical coverage through my company. Thank God for that. I just recently had to spend the entire day in the ER because I thought I had a heart attack. Luckily, no, that wasn't it. Sorry. And I was fine. Isabella is going to face a lot of different challenges over the years, sometimes, or perhaps she may need in-home supportive services on an ongoing basis. That isn't a cheap proposition. That's very expensive, especially when you take into account the number of hours needed. Not everybody can receive Medi-Cal, not just because of their financial status, but because of their immigrant status. Healthcare is for everybody, and it should be. And it shouldn't be an issue of money. Thank you.
Thank you, ma'am.
Hi, thank you. I'm Brian Stump from Novato, California. I had a small corporation for 27 years. Single payer needs to be done. In Saskatchewan, Canada, which is a relatively small province population-wise, they got it done up there. And Tommy Douglas, who was the governor of Saskatchewan, was voted the greatest Canadian of all time. They didn't think they could get it done. Some doctors walked out, some other doctors walked in. It worked so well that the rest of Canada followed suit. I did a trip across Canada just to find out what Canadians thought about their healthcare system. I started in Quebec. I went across to Ontario. I talked with people in stores and rest stops and gas stations, every kind of Tom, Dick, and Harry. Just walked up to them and asked them, what do you think of your Canadian healthcare system? I talked to over 100 Canadians. 5 said it's excellent. Everyone else said it's good. No one was coming to the United States for health care. When I asked them about that, they said, we got good doctors up here. If we have something wrong, we go in and see the doctor. That's taken care of right now. And if we have something elective, it might take 2-3 months. So that's what they think about their health care system. Regarding Medicare, why don't you guys just let Medicare bill the healthy California doctors? When you have single-payer health care, let Medicare bill them. If there's an additional billing, Healthy California take care of it. I don't see there's any problem with Medicare or making some kind of, change to our Medicare system. Just, leave Medicare alone. Healthcare is healthcare, and insurance is a profit-making deal. I had a business. I know what markup is. And insurance simply marks up something that's already expensive and makes it a lot more expensive. And you guys got 450,000 employees that you're buying health insurance for, and you need to go direct and buy them health care. Save a bundle.
Thank you, sir.
My name is Dr. Mary Bogle. I'm a family physician who trained and practiced in California for 25 years. And then 4 years ago, I moved to British Columbia. I wanted to practice in a single-payer universal healthcare system. It's been a very different and much more efficient way to practice medicine. And I'm sorry Ms. Waldron had to step out because I wanted to address some of her concerns about the Canadian system, which some of the other speakers have addressed as well. Regarding efficiency, I have an assistant who works about 4 hours per week to do the billing for myself, my physician colleague, and our nurse practitioner. I don't have to pay multiple full-time employees to bill first Medicare or the primary insurer, and then the secondary insurer, and then chase the patient down for the last few dollars. All that waste is not wasted in Canada. It's wasted here. There's no deductible. There's no copayment. Patients don't get a medical bill. There's no medical bankruptcy. And regarding quality of care, I don't have to limit the specialists I send a patient to because the best doctor is not covered by my patient's plan. I don't have to worry that my patient doesn't have insurance. Everybody's got insurance. Yes, there are waits. If my patient with chronic knee arthritis needs a knee replacement, she may need to wait for months or a year. But when my patient fell last month and had a complex fracture of her ankle, she had immediate surgery by an excellent orthopedist. And she didn't have any co-payments or deductibles and no cost other than her $77 per month insurance payment. So my cancer patients are seen as quickly as needed by an excellent team of oncologists, and they get world-class care. Any patient with an urgent or life-threatening condition is cared for in a very timely fashion. It's not a perfect system. Those patients who have elective problems may have to wait. And so I think we can do it here in California. We can do it better than they did in Canada. So let's do it.
Thank you, ma'am.
Good afternoon. I'm Leslie Esther. I am a registered nurse from Eureka, California. I practice in an inpatient rehabilitation unit. We primarily have patients that are stroke, major trauma, or traumatic brain injury. I've been able to come to several of these hearings so far, and I thank you for the 30-plus hours that you've put in listening to all the testimony, because now you know what the nurses already knew. We live with a broken healthcare system. It is not doing the job it should for all Californians. Quite a bit earlier in the testimony here with the public speakers, somebody said that we are all on the same team. I'd like to say I am not on the same team. I am not on the same team with any health insurance company that brings no value to our system but makes billions of dollars a year. I am not on that team. This healthcare system is broken. We have on the table right now a very simple, very elegant, very wonderful fix for all Californians, be they documented or undocumented. That's SB 562. Now is the time for you all to stand up, legislate, do your job, protect Californians, and get us health care, not health access. Thank you.
Thank you, ma'am.
My name is Sushila Mertens, and this system of broken corporate health care affects my family, and as we've heard today, is affecting lives of all our Californian citizens. I sit on a local board in Nevada County, and I understand the responsibility of a board to check into every angle and consequence of your actions and your decisions. And you do your due diligence, and I thank you, like everyone else, for looking at all the different things and ways that you want to make this go forward. However, when there's something broken, you don't go to the people that are naysayers and say why we can't do this. You go to the people that have solutions, and there's solutions of single-payer and healthcare systems that work all around the world. My son married a German woman, so now I have intimate experience and knowledge of what Europeans are experiencing. I'm asking why doesn't California, one of the largest economies in the world, why don't we have what these other countries have? I also want to say that you've heard the studies today and information on cost saving and answers to the questions that SB 552 would be possible and affordable. I don't understand why you keep ignoring those possibilities and those answers. And I also would like to say that I'm sorry also she's gone, because we've heard today about how many people can't afford their deductibles and choose to eat or pay their rent before they take health care. And I have to ask myself, and I wish you would all ask yourself too, which is more serious, life or death, or waiting a few weeks or a month for some service? I mean, we have to, I ask you to be responsible to get SB 562 going, and I ask you to make it work. Thank you.
Thank you, ma'am.
Hi, my name is Pat Kanzler. I'm from Eureka, California. I've been a nurse over 30 years in the ICU and the burn center, and now I work with disabled adults. President Trump and the GOP aggressively trying to dismantle the ACA, and then with their tax bill, they're just destroying it using funding. And I've got to be honest, guys. My colleagues were very articulate and they're very polite, and I'm not. I don't appreciate this select committee. You're not doing anything. You're blowing a bunch of hot air around, and that's what you're doing. You're not doing what you're being paid to do. You're my legislature. legislator, I am your constituent. Will you please release the bill and work on it already? This is nothing that you're doing. You're talking about things. And you're not making any sense. And the thing is, you only listened about SB 562 for like 1.5% of the time. And that is the answer. We have the answer right in front of us. And I also want to mention the people who raised their hand and said that, oh, well, healthcare is a human right. You're a bunch of hypocrites. If you really thought that healthcare was a human right, if you really believed in single payer, you'd be working on it right now and you wouldn't be sitting here blowing hot air. Thank you very much.
There's not much else to say after you've heard that. I'd like to express my condolences that you've been manipulated into covering over for whatever the governor and the speaker have felt was important in order to protect the money that they've been getting, which we have recorded in terms of their campaign and their resources from the health industry. It's really objectionable, and it's very, very clear. I'd like to be blunt about a few things. Number one, we do not have a broken healthcare system. It's working perfectly. It's working perfectly for the architects of that system, the billionaires and the plutocracy in this country that have a much higher objective than money. Their objective is political control. And we are in a crisis right now with the current federal administration that has fundamentally been bought by the Koch network to essentially overcome the democratic foundation of this country. Single-payer health care is the one and only universal wedge against that anti-democratic initiative that is swamping us. We do not have a broken system. It is a breaking system. We do not have a healthcare system. We have a medical management ransom system. Healthcare is not for sale. It is not for sale. We don't have a vocabulary for healthcare. I'm a physician. I'm a member of the State Physicians for a National Healthcare Program Steering Committee. We have the chapter here in the Capitol. We're available to you. I urge you, as all of the people who have stood up to speak, let this bill go. Force Rendon to put this bill into a place where this kind of hearing can really matter. Thank you very much.
Hi, my name is Marcia Martin. I'm from Assembly District 63, which Anthony Rendon represents. If it sounds like I'm repeating myself from the other times that I've spoken at the hearing, it probably is because I am repeating myself. I'm the only one here representing my assembly district, and I will keep on showing up and speaking about the problems in the people in my community face every single time you have a hearing. I was born, raised, and live in an area that was contaminated by Exide Technologies for almost 100 years. Our soil is still contaminated to this day with toxic waste dump levels of lead, arsenic, benzene, cadmium, chromium-6, 1,3-butadiene, just to mention a few. All of these chemicals, as you know, cause different kinds of cancers, miscarriages, birth defects, lifelong developmental delays, and behavioral problems in children. Our community is hardworking, predominantly Latino, working class, lower middle class, documented, undocumented, uninsured, and underinsured. When we speak of underinsured, there are many people like myself that the ACA has not helped. Insurance is not equal to health care. I am self-employed and do not qualify for any assistance. My premium just recently increased 23.3% this January from $379 to $464 a month, and my deductible is $6,800. That's $6,800 with a $45 copay. With rates like these, I think twice about getting the preventative care I should be getting, and I'm one of the lucky ones in my community because I'm insured. Important to consider is that with these residents having moved in and out of our district throughout the decades, the only way to cover all of the people that have been affected by this ongoing environmental injustice is through the single-payer, universal, comprehensive, including mental health, preventative health care SB 562 offers. Please urge Rendon to free the bill and allow it to go through the legislative process, please.
Hello, Dr. Rambula.
Hi, Rick.
Hi, it's my birthday today. I just turned 40 years old.
Happy birthday.
Okay, now to why I'm here. First off, I would, just want to reiterate, and I can't help but do so, that in order for more physicians to take Medi-Cal, which is our Medicaid program here in California, that we need to subsidize their education. And this also should be applied to psychologists, nurses, and social workers. Second, if you got elected to the legislature because of money that you received from insurance companies, it's probably not a good idea, because insurance companies suck just as President Trump sucks, with a capital S-U-C-K-S. It's very, very, I'm against the insurance company. We need to take the for-profits out of it. And why we have the Department of Managed Healthcare, DMHC, is because they oversee all of the insurance companies which we want to get rid of. Why not get rid of the managed care, get rid of all insurance companies, get rid of DMHC, and put all of the single-payer universal health care into the Department of Healthcare Services, the same one that does Medi-Cal and Denti-Cal. And I'm trying to be brief because I want to get out of here. Second, I believe that healthcare is a right, not a privilege. And I want to also let you know that as a Medi-Cal patient, I have Medi-Cal and Medicare, with Medicare being my primary insurance. I cannot get any counseling services paid under Medi-Cal. I can under Medicare, but that there's a copay. In fact, only federally qualified centers can give me counseling, and it's not really, they don't work with any specialized population. They work for the general public, and I need someone who works with the developmentally disabled. So again, if you're taking money from insurance companies just so you can get elected, that's not a good idea. You work for the people who elect you, not for those who gave you money. I'm actually thinking about running for office myself in 4 to 6 years for either Senate or Assembly, and I will not be asking insurance companies for money. And finally, I want to ask a question of the committee as well as to the witnesses who've spoken. What about Communical and CalMedi Connect? Maybe we need to get rid of them as well. Thanks.
Thank you, Rick, and happy birthday.
Thank you, chairs and committee members. Megan Subers here on behalf of California Health Plus advocates and 1,300 community health centers and clinics who serve 6.5 million patients, comprehensive health care in California. First, I just want to thank you all for the convening of this select committee and the hearings that you've been holding on this issue. This is a critical issue, and the challenge, we all appreciate the challenge before you, and we want to be partners with you on this conversation. I just wanted to hit 2 quick points. First of all, in light of the hearings that you all have convened and the introduction of SB 562, that has led the health centers to convene sort of a table of their own to talk about what the delivery system should look like going forward in the future. And they think that a good model to perhaps look at in this instance is the community health center model, which is a model that looks that for primary care health delivery available to all people, a system that provides open door access, comprehensive services located where the patient is located, culturally competent and consumer directed. And secondly, I just wanted to also express our support for the Health for All proposal that you all were presented with earlier to expand medical access to undocumented adults. We continue to be supportive of that proposal. Thank you.
Thank you, ma'am.
Hi, everyone. My name is Justin Sampson. I came up here from Orange County. I traveled 10 hours by bus and carpool just to get here. Just to let you all know, stop making excuses and release the bill now. Being somebody who is an activist in Orange County and a candidate for the state Senate, I first wanted to address the fact that the nurses here have been doing great work, and unfortunately, certain individuals in the state legislature, such as Jim Wood, Anthony Rendon, have really shown them not the respect that they deserve. So I'm here to let them know that I want to thank them for all the work they've done. I respect everything you've done, and we need to move forward. Let's move forward and pass single payer right now. The reason I'm here fighting for single payer is very simple. It's a very personal issue for me. In 2008, my mom was diagnosed with end-stage breast cancer. Rather than spending her time fighting her condition, she spent part of her time fighting healthcare insurance companies, making sure that she got the treatment that she needed. She also had to deal with co-pays. My mom and I were dealing with financially precarious conditions, and we were nearly homeless. So we had to make very difficult choices. Do we pay the $20 to go see the doctor, or is it groceries for the week, or the rent, or whatnot? This is a choice that nobody has to be making. I've been talking to community and residents in my district, talking to them about their needs, and these are choices that they've had to make too. They're fed up with a system that has put corporations ahead of them and put the millions of dollars in campaign contributions they have gotten from healthcare companies before they've put needs of the people. And finally, with the final seconds that I've got left, I really want to really stress the idea that many people here, such as Jim Wood, have stressed an idea that they believe healthcare is a human right. Well, if you believe that, here's 4 words for you. Put up or shut up. Release the bill, respect the legislative process, and that goes for Rendon too, by the way. Release the bill, respect the legislative process, and let's get to work. These nurses, myself, everyone else is willing to work with you. Thank you.
Thank you, sir.
Mary Wernette, Nevada County. I've been to every one of these meetings, and I just want to tell folks, especially those that are watching for the first time, that today was the first time the committee allowed single-payer Senate Bill 562 to be presented. All these hours, and I don't even know how many millions of dollars have been spent in defending the status quo. So please release the bill. Thank you.
Thank you, ma'am.
Hello, my name is Cynthia Brown. I'm a cancer patient from Los Angeles who has opted for surgery without chemo or radiation. I've gone through 2 painful surgeries, and as a low-income Medi-Cal patient, it is no problem to obtain insurance coverage for addictive opioid painkillers. However, if I choose the safer alternative of THC CBD oil, it will cost me $681 per month in out-of-pocket expenses from a nonprofit. If THC CBD oil, medical marijuana, were integrated into the single-payer healthcare system for cancer patients and others with serious ailments, vast sums of money would be saved because costly rehab for opioid addicts would not be needed. Additionally, long-term ill effects would be avoided. Established financial interests would oppose this reform for obvious reasons. Opioids yield big money for the pharmaceutical industry. Blood tests to screen for cancer are, according to my oncologist, only 35% accurate. He informed me that the pharmaceutical cancer industry does not care to put any money into improving the accuracy of cancer screening because it is not as profitable as treating people with advanced cancer. I hope that under a single-payer system, this could be reformed, saving billions of dollars, I imagine. Let's reform this broken system. It is morally reprehensible.
Thank you, ma'am.
Hi, good afternoon, members of the committee. My name is Adriana Mora. I am here on the behalf of the Latino Coalition for a Healthy California. For over 25 years, our organization has been working to advance and protect Latino health through policy and advocacy to build healthy communities. We believe that the wellness and health of Californians depends on all individuals having access to medical care and support services. With regular medical care and visits to the doctor, we can protect all Californians from painful, expensive, and preventable medical conditions. Without healthcare access, many vulnerable populations, including undocumented immigrants, do not seek care because of fear of deportation. They suffer from chronic pain that could be easily treatable, remain unaware of existing conditions such as type 2 diabetes, and they end up relying on banded care for all health needs. and end up accumulating thousands of dollars in medical debt and delay care, which may lead to death. In a time where our national leaders seek to target, deport, and demonize vulnerable populations, California knows better. California has been a leader for change, and we must continue to push forward and ensure that everyone has access to health care regardless of immigration status. We at the Latino Coalition for Health in California are looking forward to working with this committee and the legislator to achieve health for all.
Thank you. Yeah.
My name is Paul Brooks, a retiree from the University of California and a member of the University of Professional and Technical Employees CWA 9119. I'm also the union representative on the UC Working Group on Retiree Health Insurance. Many employees are laid off younger than age 65 through no fault of their own, ironically, such as problems like health care or health issues. They'll find at their age they cannot be rehired, cannot afford health care, and descend into bankruptcy and poverty. The increasing cost of health care is a continual issue, both at the union bargaining table and with faculty, where it's clear employees such as the university can no longer afford the increase. The current proposal from UC and other employers is to reduce plans coverage or push the costs onto retirees who cannot afford the increased cost. Single payer solves these problems and removes the healthcare issue from the union bargaining table. Support single payer healthcare and release SB 562.
Thank you, sir.
Good evening. My name is Paul O'Rourke Babb. I have been a nurse practitioner in the state of California, first in Tule Lake, and then in Chico, and then in Williams since 1986. Weirdly, to do any kind of testimony on the number of things I'd like to cover feels a little bit like what I would imagine speed dating must be like. But I'll try to cover a few things here. I've been a member of PNHP, Physicians for National Health Program, since 1992 as a nurse practitioner. I am also a secret patient victim of what we erroneously call a healthcare system rather than a profit center for illness in this country. And I will tell you that you have never had a greater popular support for doing the right thing via Senate Bill 562 in this state than you've ever had for anything. A plurality of Republican voters are for what we're talking about. 85% of Democratic voters are for what we're talking about. I want to first state that the evidence, as opposed to the advertising narrative, disagrees with Anthony Wright's, however well-intentioned, assertion that the ACA and single payer are somehow on a continuum. The ACA was a market adjustment, plain and simple. Did it benefit many people? Yes. Did it question the basic foundation of that access is a privilege based on ability to pay, subsidized or not? No. You heard about some clinician burnout. I'll tell you that market adjustments, like the ACA, occupied an increasingly large amount of my life and my staff's life in direct care time, and no amount of tweaking that system will improve either my patient's ability to get care when they need it or my ability to provide that care. And that's part of, and I'll try to make this quick, but I really want to continue what my remarks are. Senate Bill 562 provides a foundation and a framework to eliminate the labor woes and small business constriction that you were alerted to. And on the issue of MD incomes, I looked it up. 2017 family practice averages in Canada are $274,000 a year. They're comparable, if not superior, to those in the United States. Please pass 562.
Thank you, sir.
Hello, esteemed committee. My name is Amy Heinscheich. I'm a mom, and I'm the legislative and political director for UPTI CWA Local 9119. We're the union for the researchers in the campuses of the 10 campuses and 5 medical centers of the UC system, and 3 national laboratories and 3 community colleges. I wanted to echo the remarks that our retiree Paul Brooks had mentioned as far as collective bargaining agreements. the healthcare costs and cost shifting really harms labor peace in a very substantive way. And trust me, we'd rather be bargaining about other issues. But we're forced into a corner in this way to really focus. Right now, we're in the middle of bargaining. CNA and also AFSCME Local 3299 is in the middle of bargaining, and this is a very big sticking point. UC is now contemplating tuition increases, and the overly onerous nature of the major healthcare costs is forcing them, in addition to state divestment, is harming the UC mission as an educational institution teaching research and service. In fact, UC has created its own insurance company to subvert the increasing costs called UC Cares. And I don't know what type of perverted system we're under where the University of California has to create its own insurance company to try and subvert the cost overruns of other insurance companies. We'd rather be having teaching, research, public service mission. That's what we really want to be attaining. So we've had a great discussion. I've been to all of the select committee meetings. I learned a lot. That was great. But I think that what they revealed is that we had a great discussion and there's more to talk about. And what we could do to talk about those things more is release the bill, SB 562. We're strong supporters and we hope to continue this discussion. Thank you.
Hi, my name is Don Beckler. I chair Single Payer Now. We have 33,000 Single Payer Now, Single Payer supporters in California. I've watched or been at all the hearings, and the question I have is, where have you been in the last 25 years? This is not the first time this has been discussed. All these questions have come up before. In 1991, Nick Petras had a single-payer bill, hearings, bringing in people from all over the place to talk about these questions. In 1991, nationally, the Congressional Budget Office had put out a study that said if the United States adopted a Canadian-style healthcare system, that we could insure everybody and save money to boot. In 1994, we had an initiative on the ballot here that had its own studies, and everybody had a look at it. Sheila Kuehl introduced legislation for single payer in California for over a period of 10 years, and every time there were studies and authorities talking about what would happen, and it always came out single payer was the best way to go. And it's not just people talking about it. We have live models around the world in every industrialized nation that shows this stuff works. We aren't cutting new ground, but we seem to be yakking and yakking and yakking, and if this approach had been taken to, shall we abolish slavery, we'd still have slavery. If this approach had been taken to, shall we give women the right to vote, by yakking and yakking it, they still wouldn't have the right to vote. It's time to push history forward. Do your day jobs, release the bill so we can have a real discussion that means something with 562. Thank you.
Thank you, sir. My name is C.T. Weber. I'm the Legislative Committee Chair of the Peace and Freedom Party of California. Some people call us the Poor People's Party of California. And I'd like to think that if we had the majority in the legislature, that we would have had a bill like AB 562 decades ago. In any case, we need a free, and when I say free, I mean free to the users of the system, because I realize there's costs involved. We need a free, high-quality, universal, single-payer health care system. We should have had it long ago, and now I think is the time to push forward with it. Please ask Rendon to release the bill so that there can be open debate and voting, and so we know how everybody votes. Thank you very much.
Thank you, sir.
Thank you. Hi, my name is Allison Bishop. I'm a resident of San Francisco and a single-payer activist. My message is pretty simple. We have a concrete proposal, SB 562. We have solid methods for moving forward which have been presented. The economics of purchasing power are on our side, and we're tired of subsidizing the health insurance companies' profits with our tax dollars with the ACA. It's been said many times today that you want to help families, the poor, the middle class, small businesses, medium businesses, and all other California residents. Then move forward with SB 562.
Thank you, ma'am.
Gloria Purcell from Belmont. I only speak for myself, but I would like to let you know that the Green Party of California has endorsed and supports SB 562. And to the history of the insurance companies and the socialized aspect of fire departments, et cetera, just to hark back to that comment that was made by that young lady there, I don't know her name, that in London, the first insurance companies would go and strong-arm the people and the businesses on the street and say, you really need our fire insurance because otherwise, you just might have a fire. And some of them did. So that was forcing people to buy fire insurance. And if you didn't have the particular company's fire insurance, they would not indeed put out your fire. Insurance companies, as they were then, were crooks, and they still are. Thank you. Please support this and pass the bill forward.
Thank you, ma'am.
Hi, Christopher Sanchez, policy advocate with Chair of the Coalition for Humane Immigrant Rights, here to speak on the Health for All proposal that's going through the budget process. As we know through our conversations that we have with our membership through across the state of California, immigrants typically happen to work in various sectors, but sometimes work in sectors that don't happen to have insurance or any type of formal care for them. We know this through the organizing that we do with day laborers and also domestic workers. Being as such, we would strongly urge the legislature to support the Health for All proposal, and that's about it. Thank you. Have a great day.
Thank you, sir.
Susan Kohler. I'm a registered nurse. I've been a nurse for over 35 years and mostly in intensive care, so you can imagine I've seen a few things, and it hasn't gotten any better. Speaker Rendon and you co-chairs have said publicly that the dollars are not outlined for SB 562. Actually, in fact, CNA commissioned a comprehensive economic analysis that offered detailed suggestions for the financing of SB 562. As the Speaker knows, given the need for a proper study and the tight timelines for action in the Senate, in the Senate, it was not possible to include a full financing proposal before the Senate, but it was fully our intent to include a financial proposal as the bill was considered and amended in the Assembly. In fact, the Speaker's own staff member told CNA not to put the financing in the bill until it got to the Appropriations Committee. And then the Speaker froze the bill in the Rules Committee. That is a truly disingenuous way to deal with us, the public. Tell a bill sponsor not to put financing in the bill until much later in the legislative process and then subsequently freeze the bill, preventing the financing being put in the bill, and then dishonestly claim that the bill is inadequate because it has no financing in it. You are not fooling anyone. We're watching you, and we know what you did. SB 562 needs to be allowed to proceed through the legislative process and not undemocratically bottled up. You say you believe in health care is a right. The definition of a right is something that's moral, ethical, and just. So do the right thing. Pass SB 562. We need guaranteed health care for all, not guaranteed insurance. Thank you.
Hi, my name is Jacob Mason. I am running for the California Senate against Dr. Richard Pan here in District 6. And there's other people running as well. The SB 562 issue, he is against it, is probably the reason he's going to lose in the primary, I would say, in June, hopefully. So I've been following John Chang, who is running for governor. He is the treasurer, because he followed me on Twitter, and he said recently, I think last week, that he knows how California can move forward with single payer, and he knows how to budget it. So just talk to the treasurer of California, because according to him, he knows exactly how to do this. Quoting his Twitter, it's right on there. So universal health care is significantly cheaper per capita than the current system. Now, I don't know who loses when you take out the cost. I'm not that much of an expert, but if you look at Italy, for example, pulling up the statistic here, they spend about $3,200 per capita for total universal coverage. We spend about $9,000 per capita in the United States, so almost 3 times more for only some people have partial coverage. I mean, no one has universal coverage in the United States, so I guess I'm low on time here. I did notice some things that I think need to be looked at with this, which is we're not saying we're going to cover people when they travel internationally with this that I saw, and so that would be a downgrade. So that needs, I think, coverage. And I'm concerned about are we going to use this for some type of gun control thing, which I'd be against personally because I just maybe I'm a fringe candidate here, but so I don't want to see that happen. I think California's a little notorious for our gun control, and I could just see that happening with, oh, let's have government do health care, therefore we'll use it for gun control. Anyway, because I, in fact, heard someone talk about that the other day. Just my opinion. Okay. Okay, thank you.
Thank you, sir.
My name is Gil Peñaranda. I'm a volunteer for CNA. I just want to talk about one word. That word is oxymoron. It's one of the words, one of the first words actually that I learned when I was trying to speak English. It means the weirdness of 2 words when they put them together, like cold fire, doesn't make sense, right? Affordable housing in the Bay Area, doesn't make sense, right? Well, another oxymoron should be profit and healthcare. They shouldn't be together. That's why I'm asking, please, Assemblyman Renton, release SB 562. Otherwise, Renton and Assemblyman will be an oxymoron. Thank you.
Committee members, my name is Diane Torpin, and thank you for your time. I wanted to give you some real numbers on healthcare costs. My husband was forced to retire after a near-fatal heart attack. He didn't have medical insurance after retirement, but I was working and was able to insure him through my employer. I separated from my job in January of 2017. The COBRA premiums were astronomical. We looked toward Cover California. The least expensive plan I could obtain, which was a bronze plan, had an annual premium totals of $16,900. It was a $4,800 deductible per person. It worked out to be 36% of our gross. Yes, gross income in premiums and deductibles. The premiums were more than our house payment. Fortunately, he became eligible for Medicare disability last fall. Anthem Blue Cross pulled out of my county at the end of 2017. Blue Shield is my only option, and there is no competition. My premium for insurance, just for myself, is $958 a month. And if we were both on the plan, it would be $1,975 a month. Once again, for a bronze plan, over $23,000 annually. I have a $6,300 deductible. I worked. I contributed to 401ks, but it looks like all of that work is going to pay insurance premiums in retirement. Please release SB 562.
Thank you.
I'm Dr. Ron Birnbaum. I'm a physician in Los Angeles, and I want to thank the committee. In my work, I take care of largely immigrants and undocumented community, and I actually wanted to talk a little bit about something that came up at a past session, but is sort of been introduced again today in a different way, which is the issue of what I'll just call medical apartheid in the state of California. So, Assemblymember Wood, you brought up an interesting thing, which is the problem of the supply of healthcare providers, and how you thought, wow, we're going to cover everybody, but then not have the supply that's in place. Well, that supply problem is in place now, and the reason that some people feel it and some people don't is that there's not a lot of people who will take Medi-Cal. So the people who have Medi-Cal who in many cases are the victims, I would say, of medical apartheid in the state are the ones feeling that right now. So people have said today that maybe, we should try to do incremental reforms and look for a big picture thing all at once. I'm not convinced that actually the legislature has the bandwidth to do all those things. Finally, I would say that while well-intended, sometimes you get the right diagnosis and the wrong treatment recommended. That the immigration advocates who are here today, who are advocating Medi-Cal expansion as the solution to the undocumented problem, are making a mistake because they are taking the apartheid system in our state and want to expand it. So I would invite the committee and all these immigration advocates to consider SB 562 as the right approach for the undocumented and immigrants in our state. Thank you.
Thank you, sir.
Good evening. I'm Joseph Monahan. I'm a utility worker from Walnut Creek, and my generation is losing hope on our legislators these days, and I was particularly distressed that the only actionable item that I could get from this next committee hearing that's about to end is that we need more models and specifics. And I feel like we've been going at that. If whatever models you need or specifics, I'll take it home and work on it. There's plenty of people in this room that'll start. There's great models out there to start for our healthcare system. We could start by building off of Medicare or other single-payer systems that are out there. If you need more graphs, I can show you graphs about entrepreneurs or other Silicon Valley technology folks and programmers that have new inventions and new ideas, but they're scared to start new businesses and hire people because they don't want to lose their existing health care. I can show you graphs and pie charts about how the employers are spending more and more and getting close to 25% of their payroll on just health insurance. And that's not to provide a platinum plan. That's barely to provide, on average, a silver level plan. I can show you pie charts of how families are spending more and more every year, and that $500 figure that was quoted earlier by a panelist was alarming to me. This healthcare bill that I support, SB 562, would represent the largest benefit to California economy and families that would far benefit larger than any tax cut or incentive this legislation could ever pass. It would spur our economy and spur our entrepreneurs, and I hope we can get it done. Please, let's release SB 562 and let's get it to a vote. Thank you.
Thank you, sir.
Hello, my name is Stephanie. I'm a retiree. I live in District 2, Dr. Wood's district. My family was a military family. My dad was Army, my husband was Air Force, and we lived 10 years in Europe when he was stationed in Germany. When he separated from the service and we came back from the States, there was a gap between his medical coverage kicking in and his military benefits dropping. And so he played basketball with my brothers and broke his leg, and we had our very first medical bill from the emergency room, and it was a real shock to us, never having had the experience of being without a medical coverage in our lives. We're retired now. We planned really well for our retirement. We have lifetime medical care. Our retirement income is portable. We could live anywhere in the world. And we could take our health care with us. Taxes are high in California. The cost of living in Sonoma County is high. And it would be kind of a good idea to find some place where our pension would go further. But if California were actually to pass a real single-payer health care system, I'd be so proud to be a California resident, I wouldn't even consider leaving. Dr. Wood, I would appreciate it very much if you did everything in your power to make sure that single-payer health care passes in California in whatever way that you can manage it. Thank you.
My name is Patricia Johnson. I've been an RN for more than 30 years. I've worked mostly in public health. I'm compelled to respond to the speaker about dentistry. There is a 9-year-old that I'm aware of that had a root canal. The dentist was not paid for the root canal. The child's received 3 denials for a crown. And this is on a 9-year-old who needs a permanent tooth. So that Dentical is not very good. And as Dr. Birnbaum said, it's apartheid. I have a 22-year-old that was just accepted into the London School of Economics. And while he's in Britain, he'll have free medical care. So I hope he'll come back to California and help pass SB 562. Or he'll become an assemblyman like his grandfather was.
Thank you, ma'am. Any other public comment at this time? Seeing none and this hearing being on for 8 hours, I think at this point we're going to close it down. I want to thank everybody who spent the time to come here, to testify, to have their voices be heard. It's important for us as public servants to hear from our communities, and I appreciate you taking the time to come here today. Thank you all very much.